Did you know that every year, millions of people worldwide suffer from preventable health issues? Despite advancements in modern medicine, many individuals still neglect crucial health screenings that could save their lives. Shockingly, only 20% of adults in the United States receive all recommended preventive care. This lack of awareness and action can have dire consequences, leading to undetected diseases and unnecessary suffering. But fear not. In this eye-opening journey, we will explore the essential health screenings that every age group should prioritize. From newborns to centenarians, we'll uncover the strategies and insights to ensure optimal health and longevity. Get ready to discover the power of preventive care and the simple steps you can take to safeguard your well-being. Join us as we delve into the world of health screenings, revealing the hidden dangers and life-saving benefits that await. From early childhood to the golden years, each chapter will unveil unique insights and actionable advice to help you take control of your health destiny. So buckle up and prepare for a journey that could change your life forever. Are you ready to unlock the secrets to a healthier life? Let's dive in. Chapter 1: The Early Years, Crucial Newborn Screenings. Newborn screenings are a critical first step in ensuring your baby gets a healthy start. These screenings can detect hidden health issues early on. For example, a common test is the heel prick test, which screens for over 30 conditions. One of these conditions is phenylketonuria, PKU, a metabolic disorder. Without early detection, PKU can cause severe brain damage. But if caught early, it can be managed with a special diet. Another essential screening is for congenital hypothyroidism. This condition affects about 1 in 2,000 to 4,000 newborns. It's when the thyroid gland doesn't produce enough hormones, which can lead to growth delays. Early treatment can help prevent these issues. Preventive health measures, especially in the early stages of life, set the foundation for a healthier future, says Dr. Sears in his book The Baby Book. Hearing tests are also crucial. Around 1 to 3 per 1,000 babies are born with some degree of hearing loss. Early detection allows for timely intervention, improving language and cognitive development. The APGAR score, given at 1 and 5 minutes after birth, quickly assesses a baby's physical condition. It measures heart rate, breathing, muscle tone, reflex response, and color. Lastly, newborns are also screened for cystic fibrosis. This genetic disorder affects the lungs and digestive system. Early treatment can significantly improve quality of life and longevity. According to the CDC, newborn screening programs prevent 12,000 serious conditions annually. Chapter 2: Toddler Checkups, Beyond the Basics. As your child grows, regular checkups become a crucial part of their healthcare routine. These visits go beyond the basics, looking at your child's development in detail. Pediatricians use growth charts to track height and weight. This helps detect any growth abnormalities early. For instance, a sudden drop in weight could indicate a nutritional deficiency or a chronic illness. Developmental screenings are also key. Tools like the Ages and Stages Questionnaire, ASQ, help spot developmental delays early. Early intervention is the best investment for children's futures, notes The Importance of Being Little by Erica Christakis. Autism screenings at 18 and 24 months are now a standard part of pediatric care. Early diagnosis can lead to better outcomes. Vision and hearing tests are also vital. About 5% of preschoolers have vision problems that can be corrected if caught early. Hearing loss can affect speech and language development. Regular screenings can help catch these issues before they impact learning. Dental checkups start as early as age 1. The American Academy of Pediatric Dentistry recommends this to prevent cavities and other dental issues. Lead exposure is another concern for toddlers. Blood tests can detect high lead levels, which can cause developmental delays and learning difficulties. Lastly, screenings for anemia and high cholesterol might be recommended based on risk factors. According to the CDC, anemia affects about 20% of children under 5 worldwide. Early detection and treatment can prevent more severe health issues down the line. Chapter 3: Primary School Essentials, Detecting Learning Disabilities Early. When children start school, detecting learning disabilities early becomes essential. Early intervention can dramatically improve academic outcomes. Dyslexia, for example, affects about 5 to 10% of the population. Screenings can help identify children who struggle with reading early on. Attention Deficit Hyperactivity Disorder, ADHD, is another common issue. About 8.4% of children in the U.S. are diagnosed with ADHD. Early identification allows for effective management strategies. Behavioral assessments by psychologists can help spot these issues early. Speech and language screenings are also important. According to the American Speech-Language Hearing Association, about 5% of school-aged children have noticeable speech disorders. Early therapy can help these children keep up with their peers. Vision screenings continue to be important. Undiagnosed vision problems can lead to difficulties in reading and writing, impacting overall academic performance. Hearing tests remain essential. Even mild hearing loss can cause delays in speech and language skills. Regular checkups can help catch these issues early. Motor skills assessments can identify coordination and balance problems, which might indicate conditions like dyspraxia. Psychological screenings can also detect anxiety and depression. About 7.1% of children aged 3 to 17 have diagnosed anxiety. Early intervention can significantly improve a child's quality of life. Nutritional assessments ensure children are getting the vitamins and minerals they need for healthy growth and cognitive development. Chapter 4, Teen Years Tune-Up, Mental Health Matters. Teen years are a critical period for mental health. Screenings for mental health issues during adolescence can prevent long-term problems. Depression is a significant concern, affecting about 3.2 million teens in the U.S. Early detection through screenings can lead to effective treatment. Anxiety disorders are also common, affecting about 31.9% of adolescents. Regular mental health checkups can help spot these issues early. Substance abuse screenings are crucial too. According to the National Institute on Drug Abuse, about 23.6% of 12th graders have used illicit drugs. Early intervention can prevent addiction. Eating disorders often begin during the teen years. Anorexia, bulimia, and binge eating disorder can have severe health consequences. Early screening and intervention are vital. Suicide is the second leading cause of death among teens. Regular screenings for suicidal thoughts and behaviors can save lives. Sleep disorders are also common. About 73% of high school students don't get enough sleep. Screenings can help identify issues like insomnia or sleep apnea. Social media and technology use can impact mental health. Screenings can help address issues like cyberbullying and internet addiction. Sexual health screenings are important too. STDs can have serious health consequences if untreated. Regular checkups and screenings can help manage sexual health responsibly. Lastly, screenings for chronic conditions like diabetes and hypertension are vital. Early detection can prevent serious complications down the line. Chapter 5, Young Adult Checkpoint, Reproductive Health Screenings. As young adults, reproductive health screenings become a priority. These screenings are vital for both men and women. For women, regular pap smears starting at age 21 can detect cervical cancer early. According to the CDC, cervical cancer is almost entirely preventable with regular screening and follow-up. HPV testing is also important. The human papillomavirus is linked to cervical cancer and other cancers. Vaccination and regular screenings can reduce this risk significantly. For men, screenings for testicular cancer, which most commonly affects men between ages 15 and 35, are essential. Early detection through self-exams and clinical checkups can save lives. Both men and women should consider STD screenings. According to the CDC, half of all new STDs occur in people aged 15 to 24. Early detection and treatment are key to preventing long-term health issues. Fertility assessments are another consideration. If you're planning a family, it's a good idea to check for any potential fertility issues early on. Breast health is important for women. Regular self-exams and clinical breast exams can catch early signs of breast cancer. The American Cancer Society recommends women in their 20s and 30s get a clinical breast exam at least every 3 years. Early detection is the best protection, says Dr. Oz in his book The Owner's Manual. Finally, bone density screenings may be recommended for those with risk factors. Conditions like osteoporosis can start early, and prevention is key. A balanced diet rich in calcium and regular exercise are good strategies for maintaining bone health. Chapter 6, The Big 3-0, Metabolic Health Assessments. Turning 30 is a milestone that brings new health priorities. Metabolic health assessments are crucial at this stage. Regular cholesterol checks can help prevent heart disease. High cholesterol is a risk factor for cardiovascular issues, and early intervention can make a big difference. The American Heart Association recommends cholesterol checks every 4 to 6 years for adults over 20. Blood pressure screenings are equally important. High blood pressure, or hypertension, often has no symptoms but can lead to serious health problems. Regular monitoring can catch it early. According to the CDC, nearly half of adults in the U.S. have hypertension or are taking medication for it. Blood sugar tests are essential for detecting diabetes. Type 2 diabetes is becoming increasingly common in younger adults. Early detection through fasting glucose tests or A1C tests can help manage the condition and prevent complications. Managing blood sugar levels is key to preventing long-term health issues, states Dr. Mark Hyman in the Blood Sugar Solution. Thyroid function tests can help detect hypothyroidism or hyperthyroidism. These conditions can affect energy levels, metabolism, and overall health. Regular screenings can ensure your thyroid is functioning properly. Weight management is also crucial at this stage. A healthy diet and regular exercise can prevent obesity, which is linked to many metabolic disorders. Liver function tests are important for those at risk of liver disease. Alcohol consumption and certain medications can affect liver health. Regular screenings can help catch issues early. Lastly, vitamin and mineral deficiency screenings can ensure you're getting the nutrients you need. Deficiencies in vitamin D or B12, for example, can impact energy levels and overall health. Chapter 7, Fabulous 40s, Cardiovascular Vigilance. As you enter your 40s, cardiovascular health becomes a top priority. Regular heart health screenings can prevent serious issues. The Framingham Heart Study found that individuals with optimal cardiovascular health in their 40s lived longer and had fewer chronic diseases. An annual electrocardiogram, EKG, can help detect heart problems early. This test measures the electrical activity of your heart and can identify issues like arrhythmias. Stress tests are another important screening. They measure how your heart performs under physical stress and can detect blockages in the arteries. Carotid artery screenings can identify blockages that could lead to strokes. This non-invasive ultrasound test can provide early warnings. Prevention is better than cure, says Dr. Sanjay Gupta in his book Chasing Life. Blood pressure and cholesterol checks continue to be important. Keeping these levels in check can prevent heart disease and stroke. Body mass index, BMI, assessments help monitor weight and its impact on heart health. Maintaining a healthy weight through diet and exercise is crucial. Diabetes screenings remain important. High blood sugar levels can damage blood vessels and increase heart disease risk. Early detection and management are key. Lastly, screenings for metabolic syndrome, a cluster of conditions including high blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels, are vital. According to the American Heart Association, metabolic syndrome increases the risk of heart disease, stroke, and diabetes. Chapter 8, Midlife Milestones, Bone Density Tests. In your 50s, maintaining strong bones becomes crucial. Bone density tests, or DEXA scans, are essential for detecting osteoporosis early. According to the National Osteoporosis Foundation, about 54 million Americans have low bone density or osteoporosis. This condition makes bones weak and more likely to break. A DEXA scan measures bone mineral density and helps predict fracture risk. It's recommended for women starting at age 65 and men at age 70, but earlier for those with risk factors. Calcium and vitamin D intake are vital for bone health. The Institute of Medicine recommends 1,200 milligrams of calcium daily for women over 50. Weight-bearing exercises like walking, running, and strength training also help maintain bone density. Exercise is one of the best ways to protect and strengthen your bones, says Dr. Miriam Nelson in her book Strong Women, Strong Bones. Smoking and excessive alcohol consumption can weaken bones, so it's important to avoid these habits. Regular checkups for thyroid function are important too. An overactive thyroid can lead to bone loss. Medications like steroids can also impact bone health. Discuss with your doctor any medications you're taking that might affect your bones. Bone density tests are quick, painless, and provide valuable information about your bone health. If you have osteoporosis, treatments are available to help strengthen bones and reduce fracture risk. These include medications like bisphosphonates and lifestyle changes. Regular screenings and proactive measures can help maintain strong bones and prevent fractures.